And welcome to the Bridging Frequencies podcast, where I speak with interdisciplinary frequency medicine practitioners about frequency healing in FSM and beyond. My intentions with this podcast are to broaden practitioners' horizons and share different perspectives that help us better support our patients. Two, bridge interdisciplinary conversations about frequency medicine to help us all evolve this exciting modality. And three, come up with a theoretical and scientific framework for why frequency specific therapies work. I am absolutely thrilled for today's conversation with Tamara McCleary, who I have here. Welcome, Tamara. Thank you for being here.
My pleasure.
It's, I'm so excited for this conversation. I'm almost like shaking and and it's not from nervousness, it's from just pure excitement. I'm going to introduce you, Tamara, and then I'm just going to share a little bit about why I'm so stoked about our conversation today, and then we'll just dive right into it. Tamara McCleary's extensive career blends frontline medicine, scientific research, and integrative health innovation, driven by a profound dedication to healing and wellness advancement. Her professional path started as a life flight helicopter trauma nurse and broadened to encompass pediatric oncology and hospice end of life care. With nearly 4 decades of clinical and scientific expertise, Tamara has delved into the convergence of quantum physics, wellness, and psychoneuroimmunology, a trajectory initiated during the AIDS crisis and significantly shaped by her breast cancer survivor research at Stanford University in the 1990s. Recognizing the glowing influence of technology in healthcare, she pursued graduate studies at Harvard, concentrating on science, technology, and the public good, with a specific focus on the role of artificial intelligence in contemporary medicine and human flourishing. Tamara's most current research at Harvard Medical School investigates mitochondrial dysfunction, inflammation, and the regulation of aging. As a new FSM practitioner, Tamara continues to explore how the quantum field informs frequency-specific microcurrent therapy, bridging inquiry and ethical innovation to her evolving practice. Her passion for quantum healthcare applications was further ignited by collaborative speaking engagements with Dr. Brian Greene, the esteemed string theorist and Columbia University professor, who is internationally recognized for his work in advancing public understanding of quantum physics. Welcome, Tamara. I am so excited to having this conversation with you. Yeah,
That was
I
so
know. It's like
long.
that was a podcast in itself, just your history of experience. So,
Well, it's kind of
so
sad because as you're talking, I'm like, oh, well, I guess everybody knows I've been around a while.
well, your anti-aging and longevity research has paid off because we wouldn't know that by your appearance, is what I
Oh
would
my
say.
word. Well, it's funny because I really do think it's been this really incredible journey when I look, backward on it all. You know, I started at the bedside what almost 40 years ago, and in allopathic medicine, traditional medicine, we're always managing crisis, right? We come in later after the disease process has already established itself, when people are in the process of having symptoms. And I think where I am now, and what's even led me to FSM, is that I'm really obsessed with how we can keep people, ourselves, from ever getting there, from ever having an established disease process before we become symptomatic. And with anti-aging, I'm really obsessed with the brain. And since this is a podcast and not a lecture, I thought I would just get personal
Love
about
it.
it.
Yes,
And,
please.
part of the reason why I care so much about brain health is that I carry one copy of the ApoE4 allele. So we know it's one of the strongest genetic risk factors for Alzheimer's and faster cognitive decline, in the presence of neurodegenerative neurodegenerative biomarkers. And I think that's the FSM gap that I'm most passionate about, right? Is from moving from treating symptoms and issues after they've already embedded themselves and they've occurred into really being open to asking, hey, can we modulate neuroinflammation and network coherence early enough to change someone's eventual trajectory? And I don't know if you're familiar with the Marvel character Thor, but Chris Hemsworth, who plays Thor
Yeah.
in the Marvel movie, an amazing human being. He was doing a show with that included one of my favorite lifespan, health span physicians, Dr. Peter Attia. If you've never read his book Outlive, it's fantastic. But Chris Hemsworth was doing this, I think it was Disney Plus show called Limitless. And Chris was going through all these different modules of really how to optimize your health. And during that show, they did a genetic testing on him. And that's when he found out that he carried two copies
Oh, wow.
of the ApoE4 allele. I carry one, he carries two. And for him, that's like 1 to 2% of the population has two. And it increases his risk of getting Alzheimer's disease. He has a 40% risk.
Mm.
And that was just, if you watch the show, it was just an incredible realization for him. And then that was back, I think, in 2022. And then he just did a National Geographic. I think you can stream it, on different platforms. But he did this. It's called Journey to Remember, and it's with his dad, who now. So back in 2022, his dad wasn't symptomatic. Now it's 2025, well, 2026, and now his dad is symptomatic with Alzheimer's. So Chris's grandfather had it. Now his dad has it. His dad has two copies. Chris has the same two copies. So he did this. It's like a 55-minute, really cool program where he's basically sharing this motorcycle ride with his dad, where they're revisiting, they're kind of doing like this remembrance therapy where they're revisiting where Chris grew up and early memories from his father. But it's very touching. And you can see in the program where his dad just is in the middle of being present and then unable to continue or continues to ask the same question. So it's very touching. But, Alzheimer's disease, dementia in general, even mild cognitive decline is just so prevalent in our world. And it's so sad. And then, coming home to my own like one copy and, having had family history with grandparents, and my father died too early to know whether or not he would have, but I got my copy from my father because my mother had genetic testing and she doesn't have it. So who knows if my father would have had it, if he would still be alive today. But I'm just really interested in, we know that cognitive decline, when it appears symptomatically, it's been going on for decades, especially Alzheimer's disease, which is really kind of frightening when you think for decades it's brewing and we're doing nothing really about it until it shows up. And then when it shows up, is it too little too late?
Sure.
Maybe we can lessen the symptoms, maybe we can help, but it's not like we're going to prevent. And that's what I think I'm really interested in, is looking at prevention. And prevention is what really pulled me toward the quantum questions that you know me so well for, and how biology operates at the level of energy, information, resonance, and towards harnessing my work, in graduate school, towards harnessing AI as a partner in this work, right? Because now we're able to use advanced models to sift through, think about massive clinical and molecular data sets to identify maybe hidden patterns that we've never really thought about, even proposing new uses for old molecules and pharmaceutical products that we originally approved for completely different indications. So my passion is about bringing all of these worlds together, possibly.
Love it.
Bedside clinical expertise, quantum informed ways of thinking about living systems, and then AI driven discovery so we can possibly repurpose what we already have and design smarter, more personalized strategies for keeping people healthier longer.
Love it. Yeah, and I feel like just talking to you, we could have an entire podcast just unpacking your expertise in history and all of it. And I think the place that I'm so curious to start, and thanks for sharing that personal story. I think it's on some level, anyone who has an awareness of the risk of cognitive decline is like going to be very interested in this topic as well, myself included. And so, and yeah, the frequency work that we do clinically has so much potential for that. And you mentioned sort of off-label or like, not what something was originally designed for, but can have effects. I think all of that, yeah, it really is relevant for our population. I know that at the clinic I used to work at, we had a dementia prevention program that involved diet and lifestyle factors, and we developed an FSM sort of component to that. And so that might be a fun conversation to have at some point. But I'm curious because I really, the reason that I'm just in awe of what you have to offer is that when I heard you, we've had many conversations about the intersection between FSM and the quantum world. Um, the way that you described that theory and approach seemed to fill in so many gaps for me as a like, oh, that might be how this is working, and really bridge these kind of miraculous clinical effects that we have with like, how is that happening? And also, why isn't that happening for 100% of people all the time? And so I would love for us to dive into the quantum. And I guess a good place to start would be to define like what is quantum mechanics? Like that's an entire semester of information in one question for you. But is there a way for us to sort of create a working definition of what quantum mechanics is and how it might help us relate to FSM or how FSM is working? Big question.
Yeah, absolutely. I mean, it's a fantastic question, and it's one that I'm continually exploring, right? So,
Mm.
my first disclaimer is that I am not an expert. I am merely a fellow traveler along this path that's highly curious. And so, this is kind of my understanding as I have it at this point in time. And that is quantum mechanics really gives us a very simple way to talk about why. And that why is the highlight there, why FSM frequencies seem to talk to specific tissues instead of, say, blasting everything at once, right? And quantum mechanics tells us that atoms and molecules only respond to very specific energy frequencies. And I mean specific. So that's why it's just not a blast. And that's why I think, we're using the double channel, right? We're using tissue and, what we're trying to attack with the tissue or trying to mediate with the tissue. And so we have atoms and molecules within our body, and they respond to these very specific energy frequencies. And FSM really takes advantage of this same resonance principle at the tissue level when we deliver the right microcurrent frequency to the injured or inflamed tissue. And then it recognizes this frequency and it can shift back towards, say, like a healthier state. So I almost think of it as, I think when we've talked about it before, is that when you have someone who has a symptom, maybe it's inflammation, it's pain, whatever the symptom is, they're in a state of it's chaotic, it's decoherent, right? And then when you give the right resonant frequency, it just within a flash, we're talking very, very quick. It brings back everything into a much more coherent state of repair. And that's why you get, kind of that smush, that feeling in the tissue, where there's a release. It's where you see decrease in inflammation. And at the atomic level, when you think about it. So electrons can only jump between energy levels when they absorb a very specific quantum. It's packet. Think of it like
Mm,
stair steps,
mm,
right? So packets of energy are quanta, right?
mm,
They're like stair steps. So these packets of energy means each atom or molecule has its own preferred resonant frequency.
mm,
So that's what we're tapping into. And so we already know, I mean, this isn't woo woo at all. I mean, we know in biology that cells and proteins also have characteristic ways that they vibrate, right? They fold, they signal each other. I mean, we're just these electrical units. And so injury, inflammation, scar tissue changes those patterns a bit like, say, if an instrument is out of tune. And I do want to circle back. Remind me if we lose track of this, because I want to circle back on this in tune piece when we
yeah,
talk
okay.
about maybe why some uh, patients don't experience a shift, or maybe why we are not as effective at treating certain things. So we'll go back to that. But I want to finish on this quantum piece because I want to make sure that everyone understands what we're talking about, and we've kind of labeled everything the same. But FSM sends out extremely low microampule currents, right? At really carefully chosen frequencies. That's why we're very specific with our frequencies, and they appear to resonate with these altered tissues. Similar, this is very similar to how MRI works
Mm,
and how the MRI machine uses resonance to give
mm,
us images.
mm,
Um, and then, of course, we've all heard it's been used over and over again, how a singer can shatter a glass, right? How does that? That's resonance. That's a frequency.
mhm.
Um, and so when we get a match that is just right, and I think this is what we are all experimenting with within our practices, is getting that right match, creating these protocols and ways that we've seen work with different patient issues. Because when the match is right, the clinical studies in our case reports show that there's a shift in the tissue properties themselves, and then we see this from the anecdotal reports of patients from a symptom management perspective. So, what we feel as clinicians might be a softening of the scar tissue, fascia, decreased inflammation, which is measurable, it's not anecdotal,
Mhm.
and improved healing. And I think this is suggesting that we are really nudging that system back towards its more coherent, lower energy healing configuration rather than forcing it with high current or drugs or trying to force it with manipulation, which sometimes works short term but can pop right back to its decohered state. So I think hopefully I haven't confused anyone, but I think you could think of quantum mechanics as like a rule book, right? For how matter responds to very specific vibrations, and FSM as a clinical way of playing the right notes so that injured tissues can retune themselves instead of us trying to push them with more force.
Great. Yeah, I love this concept of quantum coherence. I think that um, some people might be more familiar with that state of coherence from sort of a meditation or like even a spiritual background. I know personally, I've come from a big yoga background. I did spend 3 hours a day of my life for many years meditating and understanding that we can create coherence for ourselves, like maybe without a device, right? Without an electrical input, and people are getting responses physiologically in the body that are sometimes instantaneous. And so I just like to pull that in because one of my questions for you is going to be about is the quantum field or realm spiritual? And maybe this is like another too big of a question to try to address, but in my own experience as a clinician, there are some times when someone will walk in the door and in their field of being, I can almost already know, oh, that person has mold toxicity. And then I'll, whatever, communicate with their functional medicine provider, get them tested, and it's validated. Or I'll run frequencies that neutralize mold toxicity and they'll get a tremendous relief. So part of what I'm curious is about in this quantum field is not only about these devices that we're using, which I think are, it's way definitely my interest, but also like the human system as a quantum sensor. And so kind of a big question, but curious, like if you have any thoughts around that.
No, I totally dig this line of thinking because, first of all, I think we address that we try to label things, right? So it's limited in our language, right? So we try to label things that a lot of things that we don't understand through maybe the label of spirituality.
Mm.
And whether it's spiritual or not, it just depends on your label, right? Because you don't have to have any sort of belief for, say, a tool like FSM to work, right?
Right.
It doesn't take it your belief. In fact, someone cannot even believe in it. You're working on them and it still works.
Yep.
So I think we have these tools. FSM is a shortcut, right?
Hmm.
Because think about how long you meditated. Meditation, it definitely works, but it's not quick.
No.
It's not fast.
Yes. Good
FSM
point.
is a shortcut, but
Absolutely.
it depends on your definition, your inclination. But I personally, again, this is going to be the filter through my own personal bias, but I feel that we are so much more than we actually think, right? And I think that the brain gives us these impulses from our environment to help us see a table, another person, a lamp, a chair. But I think there's more to it than that. I think of us as being energetic beings, maybe there are even cascades of light that we can't see. So I hold a space to be open that we are so much more than even our thoughts, right? And I love the feeling of expansion that you can get into when you do things like meditation, when you do things like um, focusing in on these other dimensions. But again, the feeling could also be coming from neural impulses coming from our brain. So
Sure.
um, I think for those who are timid or skeptical about anything to do with spirituality, don't worry. It doesn't have to be spiritual. There can be, in fact, energy medicine doesn't have to be spiritual at all. However, if you are inclined to that, it feels absolutely wonderful to go into that space. And I feel like anything that's supportive of those higher feelings, or those feelings of resonance with others, those feelings of oneness with everything and everyone, can only benefit the world that we live in today that is so divergent and separate. So I say more power to those of us who do feel that sort of resonance, but you don't have to feel that or
Hmm.
believe it for it to work.
Hmm.
And for me, being steeped in research and academia and that, I have to be so careful because anytime you mention the word spirituality, you're going to get people to stop listening to you. It
Yeah.
doesn't seem valid anymore. But those of us who are open to those other things goes, well, it's even more valid now. Um, but I think it's just understanding that it just works.
Mm.
We are energetic beings. Our heart, think of how the heart beats. I suffered through an AFib all last year until I had an ablation and just trying everything to go, okay, heart, work with me here. There's so much involved in the electrical conductivity of the heart. You can just think of it from sodium and potassium. You can think about it from where the nodes are. And, when you have an ablation, they're literally pulverizing your pulmonary veins because they suspect that that's where it comes from. But then you realize that the efficacy of an ablation goes down year by year by year. Why? Because probably those pulmonary veins in those areas regenerate themselves,
Hmm.
right?
Hmm.
if I get too excited, my earpods, they just come out.
Love
But
it.
I think what's interesting is that there's no denying that we are an electrical field, right?
Mm-hmm.
And we have all kinds of things going on that create this electricity. And that's why energy medicine works. And you are so correct when you say there are multiple modalities, multiple. And when I think of FSM, I think of it as complementary to other modalities.
Mm-hmm.
And so it's not that, oh, FSM only. It's instead, it's yes, FSM is a tool, but there are other things that we can bring in to even potentiate FSM.
Yeah.
Um, so like I feel like you're on the right track with saying this is a great tool, but there's other things. And you also mentioned your own intuition.
Mm.
Who's to say that's not energetic as well?
Right.
Probably very much is. And who's to say that some people are really in tune with reading
Yeah.
those fields and reading that and having this really big intuitive hit, if you will, about different things. I mean,
Yeah, and it seems like there's more research that's coming out to validate like that there's a field of information and it's almost like tuning your radio dial and getting the little information packet and some people see it visually and some people feel it in the body and um I know enough people who are getting their information like healthcare providers and body workers that have shared. They get their information that way. And it's like, well, if all of these people are describing the experience of the download or whatever you want to call it in a similar way, then yeah, maybe it's like you said, maybe it's not spirituality. Maybe it's we haven't defined the science to explain it fully yet. And I think that's where I think the quantum field is exciting because it seems to be able to go there in a bigger way than like classical Newtonian physics could.
absolutely. And I think the reason it can is that it's not already decided. So I
Mm,
think, what you and I have talked about many times is that the beauty, I think, for the future of this is having an open mind and being able to, all of us are researchers, all of us are investigating, all of us are curious, and sharing collaboratively what we find works or, has worked, or, even if something didn't work, but just sharing and growing this field. But I do think that what you're tuning into, whether it's a feeling or a perception or a seeing, I know in nursing for me, the sense of smell was really
mm.
indicative. It sounds really strange, but I felt like I could smell cancer.
Oh, wow.
Like, yeah. And so I think that we have these senses that oftentimes we're not tapped into, or because we're not open to it, maybe we're not feeling into it. I remember alternative medicine became really, really important to me back in 2000 when my son wasn't progressing. He was newborn. He wasn't progressing in uh, his stages of development. He wasn't rolling over on time. He wasn't walking by 18 months. He didn't have speech. And when he was finally diagnosed with autism, well, he was nonverbal, is that I tried everything. I mean, no stone unturned. I did everything conventional, of course, but everything unconventional as well. I mean, I did every wild thing you could possibly imagine,
Mm,
because I figured, well, why not?
mm,
Right.
mm.
And I don't know what did or didn't work because unfortunately, I didn't have the luxury of just trying one thing at a time like a good researcher would. Instead, I threw everything at it because I was a desperate mother. But now he is 25 years old and I can't get him to stop talking, just, yeah. So it's, to me, that was just mind opening. Some of the things that I did, like sound therapy,
Mm.
and I did aggressive, sensory occupational therapy and, speech therapy and every kind of therapy you can possibly imagine. Acupuncture. acupressure. Um, like I said, I think there's multiple roads in, and not just one. It's not like this is the way, the only way, but there's multiple roads in, which is why what's also curious for me with FSM is that, with energy medicine is really great at removing an interference,
Mm.
say like inflammation, right?
Mhm.
Or scar tissue, removing an interference so that communication can go back to a healthy way.
Mhm.
Where energy medicine seems to not be as effective is in adding something, such
Hmm.
as a substrate
Hmm.
or adding to an organ that's missing,
Hmm.
right? It seems that energy medicine is great at tuning the instrument. So I would say, like, a great visual for this is you have a violin, FSM or energy medicine can tune those strings because maybe it's way out of tune, can tune those strings so the instrument plays beautifully again. However, if a string is missing,
Hmm.
energy medicine can't provide the string.
I love that. I'm gonna
So
just like quote Carol McMakin, who we both trained with. She says, "You can't put back something that's not there." And so
true.
that's the same
Yes.
idea. It's so interesting. And I always want to hold the possibility that you can. Like it's like, well, we might as well try. I think it's generally true that that's not nearly as effective as like the taking away of scar tissue, the removing of inflammation, the removing of a pathology, the neutralizing of a pathological state. Yeah, didn't mean to interrupt, but wanted to
Oh
quote.
gosh.
Yeah,
No, you should jump in anytime
yeah,
because
yeah.
you're a very experienced practitioner. I think what the good news is about that, again, if we look at what we're doing with FSM or any type of energy medicine as a tool, is that if we can't create the substrate, maybe we can get the substrate from another modality, like allopathic medicine.
Cool.
Maybe we get the missing molecules from a pharmacologic intervention
Totally.
or maybe a transplant, right?
Sure.
Okay, so we don't have the healthy tissue to even be able to do anything with, but what if we can replace it with a different
Sure.
mode
Totally.
and now apply FSM, right?
Yeah.
So we might have a surgical intervention and FSM. We might have new drugs that we are going to harness and FSM. So it's an and,
Mhm.
not an or.
It almost leads into this conversation of the stable state in FSM or like hydrated tissue and enough minerals and yep, and good nutrition. And then also even uh, mitochondrial like capacity. And maybe it is a demand and maybe it's just an instruction to help. We know that the frequencies increase ATP. Um, and it's an interesting question. Like, are we actually demanding more mitochondrial work when we run microcurrent, or are we giving energy so that the mitochondria can work? And but having that stable foundational raw materials for the body to do what it needs to do in order to execute the frequency instructions. I wonder, too, if that has to do with some of these successes or not successes on the almost instantaneous quantum level that you were alluding to earlier, like the tuning of the string, um, being effective in some people, but maybe not on others. And I'm wondering if you want to speak to that from a sort of quantum lens.
Yeah, I mean, so great you brought that up. And again, reminding everyone, I'm not speaking as if I know and I'm all knowing because I'm not. But when I think about all of this, for me, I'm trying to put the pieces together too. It's a great question you're asking about when we increase ATP production using FSM. We don't know at what point do we exhaust the system? Do we exhaust the mitochondria? The posited question is it limitless within ourselves? And the thing is that it's a great question to ask because, we have seen in many other situations where it is not limitless and we
Hmm.
can exhaust a system,
Hmm.
correct?
Hmm.
Which is why you brought in things like nutrition, hydration. What I will say about nutrition, hydration, and things like that is think about architecture and substrate. Substrate would be nutrition and hydration. And you and I both know, and you tell your patients, hydrate before you come in for your session. Because if someone's dehydrated, we know that it's going to be less effective no matter what you do. So you can only squeeze so much out, correct?
Hmm. Totally.
And this swings back to even your peptide question, and that is when you augment someone with a peptide. And to your point, you have to look at with everything that you would do, what would be the pros and the cons, right? So, a huge con is obesity, especially obesity where someone is really on the verge of a lot of clinical health issues. There's a lot of bad things that happen from um, you know too high of a BMI, right? So to me, that's a really strong indication that maybe some of the side effects, such as, having that onloading where they may have nausea at the beginning, vomiting, a lot of GI discomfort because there's some adjustment period. And then once they're on, usually those things subside. If you can get them to a healthier weight, you've just done a really good thing. But in addition, what those GLP-1 agonists do is they mimic at the cellular level, they mimic like being on a keto type diet
Hmm.
where this you are actually creating a healthier turnover of mitochondria. It's kind of a mini starvation state. And so you've heard of intermittent fasting. What are people trying to do
Hmm.
with their bodies with intermittent fasting? They're trying to reboot their mitochondria. They're trying to slough off the ones that are tired and worn out so that they get new, healthier mitochondria in the cell. That's what intermittent fasting does. That's what the keto diet does. And when you give someone a GLP-1 agonist, it's mimicking that.
Hmm.
Um, the drug Jardiance that they are using for heart failure in patients is a diabetic drug, but what they found it does in the heart is it creates this kind of keto state for the heart where it becomes much more efficient at energy metabolism. So this is where I think we have to be open to collaborative allopathic pharmaceutical energy medicine to really see miracles happen.
Hmm.
We have to be open to how they might work synergistically. And so if say a peptide creates more healthy um, cellular energy, then when you do your FSM on a patient, they're going to have a better outcome.
Hmm. Hmm.
So the inappropriate ways of using GLP-1s is for someone to get just skinny. They want to
Hmm.
look better in their bathing suit for the summer. This is not the
Sure.
appropriate method. But if someone is genuinely struggling, they've been on many diets, they've tried everything, and they're not having success, and they are at a high BMI, then we know that it really is a healthy thing to do. And it does do healthy things for the cells. Like I
Hmm.
said, it's neuroprotective, cardioprotective.
Hmm.
They're actually looking at it. They're actually using GLP-1 agonists in a lot of different studies, including Alzheimer's disease. So
Interesting.
we should not, because of its side effects, we shouldn't immediately eliminate it because a lot of the side effects are reversible and they
Hmm.
do go away.
Hmm. One piece, it's like interesting. We're talking a lot about GLP-1s today, but
I know, and I didn't
I,
even think we were going to talk about GLP-1s.
yeah, and I w watched a recent training on because so many of my patients are taking the GLP-1s and did a training recently, and it was really, I think, speaks to sort of this stable state we're talking about. Talk about how important it is to heal like the emotional factors of core shame, core grief, and repressed anger. And I thought that that was like, it was just cool to hear people come out and say, like, there is probably an unresolved emotional component to, you know, challenges with weight loss. And, and I think I'm mentioning that too, because in my experience treating patients with FSM, um, I mean, this is a broad statement and but it's generally true in my experience. There's often, if not always, for a chronic condition, some type of underlying emotional piece that is worth addressing. And that's part of what in my own personal practice has driven me toward trying to understand nervous system regulation and trauma healing, because I've found that people can stay in a loop and it might be a different injury that happens every so often. It's almost like this repetition of a different permutation of the core wound, if that makes sense, over the lifespan. And we go back and we go, wow. And from not a frequency specific microcurrent perspective, but from a tuning fork perspective, I use tuning forks in sessions sometimes. It's like this beautiful model that those things live in the field, live in the energy field, and like rings of a tree. If we go out far enough, we can actually feel the effect in the field and help reintegrate it. So, and often it is related to that shoulder pain. It's like off the shoulder in the field, or that hip pain, it's off the hip somewhere in the field. And I would think that was crazy if someone told me it, but I've experienced it enough times that it's like this is a real phenomena. We can actually palpate this in the energetic field around the body. And so that's a long-winded way of saying I think that if we're targeting like shoulder tissues for your chronic shoulder pain, and it's not working. If you've got frozen shoulder and we've just moved all of the scarring, we've removed fibrosis and adhesions, we've decreased inflammation, we've mobilized the joint capsule, we've released the subscapular muscles and the long thoracic nerve. If we've done all of that and somebody's still got frozen shoulder, often we have to look into um, childhood trauma, past trauma, whatever. And and it's important, of course, to like refer out if you need to get someone who has the training to be able to handle that. And be interdisciplinary in your approach because and then also we've got our emotional frequencies, which are usually helpful. And so from the quantum lens, which is what I keep wanting to come back to with our conversation, could it be that, I mean, to me, that also kind of helps to explain like why some people we remove scarring and frozen shoulders gone, and it's like never to return. Great, nice seeing you, off you go. And others, it doesn't work that way.
I think you're bringing up such a really important topic because where quantum is at work, even when you're talking about emotional states and trauma, we know we've always talked about how many years have we talked about that trauma is held in the body, right?
Yeah.
And the autonomic nervous system, trauma history, and emotional states are all encoded in the tissue's electrical and mechanical patterns, right? So when FSM restores coherence in key structures, so like say the vagus nerve, right, really important, the diaphragm, tissues around the heart, it changes the body's base electromagnetic and mechanical platform. And that change actually propagates through the interconnected wiring of the entire nervous system and fascia. And what you see there is a signaling to the limbic brain that the body is safe.
Mm.
So then decoherence locks in a more regulated, coherent whole body state. So cognitively, they still have the memory of whatever the trauma was, but then what you've effectively done is removed it so that the body itself is in a safe state. Does that
Mm,
make sense?
totally. Yeah. And sometimes going to the frequency specific level, sometimes, yeah, just supporting the fascia and decalcifying and scarring and supporting the nervous system. There's always a nervous system component as far as I'm concerned.
Hmm.
I'm glad you mentioned the vagus because, like, yes.
Hmm. I know
Um,
you're a big fan.
yes, I'm the Vegas is number one fan. But yeah, sometimes just dealing with things mechanically is amazing. And
Hmm.
and sometimes dealing with things mechanically evokes a release, right? A tears, crying, like, I don't know why I'm crying, but it's, and it's like, yes, that's welcome. It's just
Hmm.
a release in the body. And sometimes that's not all it takes. It takes like a deeper um approach and different frequencies, or, like I said, referral out to somebody who can help people with strategies for nervous system regulation and exactly what you said, safety in the body. In some cases, people will run, for an example, like calm the sympathetic nervous system. And that body does not feel safe when the nervous system is calm, when the sympathetics are calm, because they're in this sympathetic drive. And so doing that is actually an unsafety experience in the body. And so it's like, what can we do to help this person regulate, self-regulate, and achieve safety while we're giving this novel input. And I'm saying that because lately have had more people with upregulated nervous systems where it's like
Hmm.
not as simple as just, oh, let's just calm your sympathetics and you'll be fine. Used to be that
Hmm.
way. I think globally, as things feel more tumultuous, we're getting like nervous systems that are feeling not safe. And just speaking to that, not only like our geopolitical, like what's going on, but also um, 5G, satellites, EMF exposures that we aren't even aware of and we're told are not a big deal, I think have a lot to do with the body's experience of safety. So,
100%. I mean, everything you just said, underscore, underscore. And I think that the thing I think of when you talk about this is how important an interdisciplinary approach is to our patients, and
mm,
that it will not be just us or our intervention sometimes that's helpful. I mean, when you talk about someone who's had trauma in the body, a good psychotherapist
mhm,
in addition to FSM is very supportive because as you're clearing and you're creating a more coherent, healthy communication in the body, and the body is starting to feel safe, the mind still has the remembrance of and has the power to recreate over and over and over again this unhealthy pattern. So if you're working alone, you may just be constantly trying to unwind the pattern and then it rewinds. And so, yeah, I think that an interdisciplinary collaborative approach, and I think psychotherapists who apply FSM themselves are absolutely magical because then they've got all kinds of tools in their tool basket. Um, so I think, really approaching things from, what skills do I have and maybe what other skills do I not possess that this patient could really use or might be complementary to what I'm doing.
mhm,
Certainly, what you mentioned is very true. We have all kinds of invisible interference going on.
mhm,
It's chaotic. I don't know if you've ever had the experience of going, here in Colorado, we go way up into the mountains where there's no Wi-Fi signal, there's nothing around, and all of a sudden, the world feels right again. And you're like, wow, I really want this experience. And you think, well, maybe it's the hiking. Well, it might be the fact that you've just gotten to a place where there isn't all this invisible, chaotic energy going on.
certainly.
Um, and so I do think that all of that does play a role. I think we're going on to 6G now. We're definitely, I mean, if we had eyes to see, sometimes I wish I could just see all of the energy going on around. Maybe it's better that we don't, but it has to impact us. It has to be impacting us from a health perspective, from a psychological perspective. Yes, the geopolitics is very unsettling. I also think that the economy is really scary for a lot of people. We don't know the future. And I think the not knowing is always worse than the knowing. And so things are unsettled right now.
Mhm.
And that unsettling is difficult for people. And then our young people coming up, well, you're young too, but I'm in my 60s. So I think of like, oh, the young people coming up, there's a lot of struggles, just basic struggles. The cost of food is so high. And especially if you're trying to eat healthy,
Mhm.
the cost of healthy foods has gone way up. And don't even get me started if you're trying to eat organic and GMO free, that's even more expensive.
Mhm.
And yes, we need to support our farmers, and yes, we need to support those people, but it all costs money.
Mhm.
And I think that it's really difficult. And all of these pressures are put upon people. And yeah, it's a lot. It's a
Mhm.
lot. And I should speak to you and our audience too. It's a lot of pressure for the practitioner. I
Mhm.
think those of us that are in the healing and caring fields is that you can get a lot of burnout.
Mhm.
There is a lot of burnout in the healing profession. As a nurse, I can tell you nurses suffer from massive burnout and also PTSD because of the stuff we have to see and deal with, right?
Really.
I told you, like, I started off in the AIDS crisis in the 80s and just people dying everywhere all the time. That was just such trauma. And of course, no one ever deals with it. And then when most recently we had the pandemic, and I don't think any of those frontline workers have had adequate PTSD support. And
Or,
so we're taxing our helpers,
totally.
our light workers, if you will,
Mm.
because we don't go into this profession because we want to be billionaires. It's
Right.
not going to happen.
Right.
I think that's something that definitely binds us all together.
Mm.
In there's something a commonality between all of us that are interested in healing, in alleviating suffering. There's something that binds us. And I think, part of this collaboration I'd love to see, and now as a brand new FSM practitioner, I'd love to see it in the FSM community, is supporting one another so that it doesn't start to feel overwhelming as our patients are sicker
Yeah.
and have more complex medical issues that are not straightforward. They have comorbidities off the charts. And sometimes you wonder, gee, which tissue should I start with?
Mm.
I mean,
Yeah.
there's so many that it would be nice if it'd be really cool if we had like this great collaborative bank to go to where
Totally.
we didn't have to take it on all ourselves and
Yeah.
we had the support of one another because we will burn ourselves out if we feel like it's up to us to save the world.
Mm.
We have to do it together.
For sure. Yeah. I love that message. And it's something that I'm personally like very interested in. I really, one of my longer term dreams is to establish like a foundation where we can do frequency research and like really validate, why does this work and why does it work this way and not that way? And what are these frequencies actually? And answer some questions that really should by now be answerable, right? And I think it's totally doable if we get the right funding and approach and support, and it doesn't have to be complicated. So yeah, so thank you for sharing like this perspective of collaboration, which I love. I mean, the more openly we can talk about all of it without being afraid, like, oh, did I just make a claim and am I going to get like whatever? It's like, can we just be open and communicate what we're seeing and what our questions are without being like attacked for whatever? Because then we can move forward so much more quickly and exponentially and have open conversations about what we're finding. And so, I think we're on the verge of it. I think there's like this expansion happening that feels very exciting within medicine. It's like you can see it from one perspective where it's like this is a big pile of mess, or like there's a new way that's sort of being paved and opened, and I think people are more open-minded and we're finding the science to validate some of these phenomena that we see clinically. So, um, I choose to believe we're living in a very exciting time in medicine and a very expansive time. Um, and yeah, there's a lot of crazy stuff going on, and that always pressurizes innovation and I'm hopeful collaboration and all of this. And so thank you for collaborating, for sharing what you know, sharing your experiences and your perspectives. I really love any chance I get to chat with you about all of this.
Absolutely. I mean, I think this has been really just a fun conversation for me, and definitely for wanting to having the desire to connect with your listeners. You know, I think we have to be gentle with ourselves and realize that we're all just explorers on this really wild adventure called this lifespan that we have, which is so, so short. And I think my call to anyone out there is if anyone else is interested in prevention, it's not a moneymaker because people really only start clamoring to us when they start having, pain and suffering and problems. But prevention, I still, at my heart, as a clinician, think that that's so key. And, if we can maybe just support one another, and the minute you hear something from someone that you disagree with, is to first remind yourself that if they're in this industry, they're in it for the highest reason. They're just trying to help. And remember that everyone's intention is is the highest intention. And I think that whenever someone shows us something that we didn't see before, or we immediately feel triggered by, like, no, that's not how it's done, I think that's exactly where we should look.
Mhm.
Because our greatest teachers are the ones that probably trigger us the most, right?
Absolutely.
Um, but yeah, I'm excited for this industry. I think we have to support ourselves because I do think that there's a lot of hurdles as to why we don't have funding. I think if you find this to be extremely effective, there's a lot of reasons monetarily why other entities would not be so enthusiastic about that. But I believe good wins out. I believe light wins out against darkness. And I hold the highest hope for those of us to gather together, because the stronger we are together, I think the brighter light that we are, the more we can make change. And, every time we just change one person's life in one positive way, it made it all worth it, didn't it?
Totally. That's what it's all about. I
And
love
look, I
it.
got to meet you through this. So
I
no
feel the
matter what
same way.
happens, I feel blessed because we got to cross our paths. And I'm just so grateful for everyone who is brave enough to walk this path and be an explorer together on this really wild adventure.
Hmm. Feels like we're just getting started. I'm very excited for what's to come, and thanks for sharing yourself with everybody today and your insights and just thank you for being who you are in the world, Tamara. And I'll include a way for people to get in touch with you if they're interested in reaching out below the video. Um, I don't know, any closing. I mean, that was a pretty beautiful closing remark, but anything else that you feel like you'd love to share? Or, I mean, for me, I feel like I just have many more questions than I even came to this conversation with, and I think that's very exciting, because it just opens, yeah, it opens possibilities. But is there anything else you want to share before we sign off for the day, um, about the quantum, about frequency medicine, about um, any really even about intuition or being a practitioner in this crazy world right now?
I think, you know, one thing I think it's important to remember is that, intuition and those gut feelings that we have, and sometimes we discount, especially if we go to our head first. No, that can't be real. Is to just start to maybe tune into those even more. The one thing I love about quantum is that it's all possibility.
Hmm.
And when I even just meditate on all possibility and what that means, the expansiveness is just phenomenal. And so, you know, always believe. I mean, the one thing I think that's the biggest detriment in healthcare is already having a diagnosis that's decided for us, because immediately I think it stamps out any possibility for some other reality. And I do believe there are other realities. So I think hanging on to that belief, supporting our patients to always believe, not giving them unrealistic expectations. That's not what I mean. But being that bright light of support, going, this does not have to define you. I have seen miracles before, and I can say that with all honesty because having worked in hospice, the best thing in the world was discharging patients because they no longer met the hospice criteria because they weren't dying. I mean, I have seen miracles. I've been a witness to miracles. I think that, having that miracle mindset is really important for not only our own buoyancy as a protector against burnout, but also to support our patients because oftentimes in the allopathic world, it's not very uplifting at all.
Hmm.
The clinics are depressing. Paint color on the walls is depressing. I mean, it's just awful. And from a psychological perspective, it doesn't look like a place of healing.
Hmm.
It
Hmm.
looks like a place of disease. And so I love our offices. I love the way that we'll do things like charge our water and have the spirit. I do believe we bring an energy to everything. We bring an energy to our patient. We bring an energy to our families. We are so powerful beyond our comprehension. And if we would not forget that, and bring our energy and our vitality, because I do believe it can fill an empty vessel.
Hmm.
If there isn't enough substrate in someone, I do believe that maybe we can be a surrogate until that they do have that energy, until
Hmm.
they do have that vitality. And so I get excited because when I tap into the ultimate potential that is out there that we can't see, but some of us can tap into and feel, that's where the magic happens.
Hmm.
And we may not be able to explain the why. And
Hmm.
that's okay.
Hmm.
Because for me, at this part of my journey, in my 60s, I've come to the realization that unless I can defy the odds, I don't have a whole lot of time left.
Hmm.
Is that the why no longer holds so much power?
Hmm.
It's just that it does.
Hmm. Hmm.
If it works, or if it ain't broke, don't fix it, right? If it works, do it. And we may not have the language or the knowledge at this point to explain the why. AI might for us. It might. We might not, but we don't have to know why to know that it's working.
Hmm.
And so continue to do it, even if you can't explain why, even if you can't get the funding to do, you know, RCTs, probably won't happen. we can still do it. We can still have an effect. And if enough of us are having an effect, I don't think you even have to have a why.
Mm,
I think people will clamor for it because it is working.
sure. Ah, beautiful.
But
Thank
you're
you
young
so
enough. You
much.
might come up with the why.
Ah, we'll see. Thank you so much, Tamara. This has been amazing. As always, any conversation with you is so enriching, and I super appreciate all of your sharing. Um, and yeah, and just best wishes on your journey with this new tool, FSM, and incorporating and collaborating all of it, because yeah, because that is a beautiful aspect, I think, of FSM is how well it just plugs into anything else you're doing and how complementary it really truly is. Um and yeah, thanks for these perspectives on the quantum and um I really look forward to seeing what more it evolves into, at least from a frequency perspective. I think there's a lot to learn from quantum theory that does help with the why. And I'll keep picking your brain around that for as long as I can.
I think I just love mystical, magical things.
Yeah, I
It's probably
love
the
it.
Pisces in me. I'm a total Pisces. So I just totally worship the mystery, if you will. I
That's
mean, I
beautiful
love
too.
mystery and magic. And sometimes it's the unexplainable that's the most tantalizing and
Mm,
luscious and scrumptious. Um, and I'm okay with that. I'm okay with that as long as whatever it is doing, it is doing it. It is. And that's exciting. But we need we need young people like you to, fine tune and tease it. But I wouldn't want that to stop you from ever just moving forward because you're doing amazing things in your practice. I mean, yeah, I could talk about the things that you actually eliminated in me, which is so phenomenal. I have not had low back pain in like 3 months. It's amazing. Um, but I
So,
think it was FSM in combination with your manual therapy because you
mm.
are like the bomb manual therapist.
Thank
Seriously.
thank you.
So I, as a nurse, do not have any manual therapy skills to give you whatsoever. I can give a pretty mean massage, but that's it. But I mean, you might crack that code, but don't let that code limit you because you're seeing how it works. You're feeling it. You have an amazing intuition and just harness that to continue doing all these great things that you're doing. Um, and anytime you feel tired, which I'm sure you do, just just grab hold of that and don't worry that you can't explain it yet. Who can really explain quantum computing yet? I mean, theoretically, sure, but then you get into all kinds of crazy things like the multiverse and string theory and some of these things you just hold in your consciousness even if you cannot explain it.
Mm,
Yeah.
love it.
So
Awesome.
embrace the mystery. Yeah, that's my word. Embrace the mystery.
That's it. That's the perfect end to this amazing conversation. Thank you so much. Embrace the mystery. Until next time, thank you so, so very much. Bye, everybody, for now.